The heart is a muscle that pumps blood to the body, and the term heart failure can sound frightening. The form of heart failure that is most commonly recognized among people we call heart failure with reduced ejection fraction. And what that means is that people have symptoms of heart failure and their heart has been weakened. The two most common causes in America are a heart attack or high blood pressure. But there are other causes to it, like valve problems or electrical rhythm disturbances. The problem with heart failure is that its symptoms overlap a lot of other disease processes, and so it's hard for people to know whether they have heart failure or not. The most common symptoms of heart failure are shortness of breath, fatigue, and swelling. It's really important for people, if they have these symptoms, to get in to see their doctor. So if a patient came in to me and we wanted to know whether he or she had heart failure or not, we start out with the basics. I ask them questions about their symptoms, and that gives me a lot of information to say whether they have heart failure or not. And then we do testing like an EKG. An echocardiogram, which is an ultrasound of the heart, is absolutely necessary to determine if they have heart failure, and if so, what type. We have blood tests that help us out. And then we have a panel of different physical exam findings, like how high their veins are in their neck, their swelling, and then what their chest x-ray shows that help us to determine whether they have heart failure or another disease process that can seem like heart failure. There's certain medications that have been shown to reduce the symptoms of heart failure and especially reduce the death rate that goes along with heart failure. Then in addition to medications, we have add-on therapies like defibrillators or biventricular defibrillators, left ventricular assist devices, or even open heart transplant to help people out. But in addition to all these important therapies, patient lifestyle changes are ultimately important. And so diet, discontinuing tobacco, discontinuing or decreasing alcohol, avoiding salt, weighing themselves daily, and regular exercise are vitally important. And finally, we have cardiac rehab, which has been shown to both physically and emotionally help people with heart failure. The most common form of heart failure is what we term heart failure with reduced ejection fraction, and that's where the heart itself has weakened. But the other form is much more confusing. It's called heart failure with preserved ejection fraction. And what that means is that a person has symptoms and signs of heart failure, but the heart function is normal. So right now, we really don't know what the cause of heart failure with preserved ejection fraction is. We do know that it's more common in people with sleep apnea, high blood pressure, atrial fibrillation, and obesity. Unlike heart failure with reduced ejection fraction, where we have multiple treatments that seem to help, for heart failure with preserved ejection fraction, it really seems the only treatment that works right now is diuretic therapy, also known as water pills. Although we have all these great treatments and advances in heart failure, there's still 50% of people will die within 5 years with either form of heart failure. And the earlier somebody gets in, the likelihood is that they're going to do better. In my personal experience, I think people are doing better than those statistical numbers, but that's because we're getting them in earlier, we're treating them aggressively, and we're getting them better sooner.